Officials say that the Las Vegas death toll now has climbed to 59. Joining me by phone, Danita Cohen is the spokeswoman for the University Medical Center in Las Vegas. Danita, thanks for joining us. We know that there are 527 injured at this moment, and the question is, it's such an overwhelming number. How have the medical professionals decided who to help, who not to help, or when to help? It seems like one of these situations that you can never be prepared for.
Well, it's a situation that we absolutely prepare for because we know that, unfortunately, tragedy will strike, and that's why our Level 1 Trauma Center is here. We are the only Level 1 Trauma Center in Nevada. Patients are actually triaged out in the field by trauma field triage criteria. Their emergency transporters determine which hospitals patients will be going to. As the only Level 1 Trauma Center, we will receive and did receive the most critically injured patients, as we did last night. We also received several patients who went to our emergency department as well. Our trauma center is a standalone trauma center away from the emergency department.
I think what I was referring to is Greg Castle, fire chief, talked about the dozens and dozens of ambulances, just a sheer number. But, of course, you have been lauded so far because it's been remarkable the ability that you've had to save these lives. Again, even though you've had preparation, actually going through something like this, the worst mass shooting in the history of America, what have you learned?
What I've learned is that I am extremely proud to represent the hospital here, the only Level 1 Trauma Center. We were very prepared, even for an influx of 104 patients who had, critical, life-threatening injuries. It's exactly what we trained for. Just a couple months ago, we had a mass casualty training incident by one of the trauma physicians who was on duty the night of the Pulse nightclub shooting at Orlando Regional Medical Center. And we train not during 8 to 5 Monday through Friday for mass casualties. We train during the night and on the weekends because that's when these types of things, typically happen when the majority of people aren't at work.